Today we're going to walk through the intervertebral articulations, ligaments, and cartilages of the vertebrae. First, we're going to look at the intervertebral discs, which sit between the vertebral bodies and provide support and absorb shock during flexion, extension, and rotation of the spine. We see them here between vertebrae and here with some of the vertebrae removed. The IV discs have an outer layer called the annulus fibrosus and a jelly-like central portion called the nucleus pulposus. Next, we have the anterior and posterior longitudinal ligaments. The anterior longitudinal ligament runs along the anterior surface and connects the anterolateral portions of the vertebral bodies and intervertebral discs. This is a strong, fibrous, broad band that stabilizes the intervertebral joints and limits extension of the spine. The posterior longitudinal ligament is narrower and weaker than its anterior counterpart. It runs along the interior surface of the vertebral canal and joins the vertebral bodies and IV discs from the posterior side. This ligament prevents hyperflexion of the spine. Also found within the vertebral column is the ligamenta flava, shown here, which is a yellow, fibrous, elastic ligament which connects one vertebral lamina to the next. This tissue protects the vertebral column from flexion, thereby supporting and preventing injury to the intervertebral discs. The interspinous ligaments are here, which are broader sheets of tissue that connect adjacent spinous processes. This tissue layer is very weak. However, the ends of the spinous processes are bound by very strong connective tissue called the supraspinous ligament. In the neck, the supraspinous ligaments merge with the nuchal ligament, a strong fibroelastic ligament of the neck which runs down the spine, connecting the spinous processes of the neck up to the occipital protuberance of the skull. This nuchal ligament allows for muscular attachments. Moving from superior to inferior, the cervical vertebral articulations allow for anterior, posterior, and lateral flexion and extension, as well as rotational movements. The thoracic vertebral joint planes allow for significant rotation of the trunk. However, flexion of this area of the spine is limited. The lumbar vertebrae allows for flexion and extension of the spine, but not rotational movement. And finally, we see the only two atypical vertebrae. The atlas articulates with the occipital bone of the skull superiorly and articulates inferiorly with the axis. The atlanto-occipital joint allows for flexion and extension of the neck. The atlanto-axial joint allows for rotation of the head as the atlas pivots around the dens of the axis.